Welcome to Eval eCare Virtual Health Connections. I'm Jessica Gaikowski. Today, we're focusing on a different setting, one that impacts communities every day, but often doesn't get enough attention, which is school health. Schools work hard to support students, but many don't have consistent access to a school nurse, leaving office staff, teachers, and administration to manage health situations they may not be fully equipped to do. Today, we're talking about how we bridge the gap, connecting school staff to experienced nurses in real time so students can receive timely care, staff feel supported, and classrooms can keep moving. I'm joined by Sheila Freed, Clinical Operations Director of School Health and Senior Care at Eval eCare. Sheila, thank you for joining us today on the podcast.
I am so happy to join you today.
Well, to start us off, Sheila, do you want to give us a little bit of background about yourself and how you went from in the school to being more of the virtual liaison to help support those that are at the school now today?
I will. What you were saying in that introduction is so true. It was my experience. So my first school nurse job, I was in rural South Dakota, and I drove 100 miles a day just to do all the tasks that I needed to do. So then we moved to Sioux Falls, South Dakota, which is our largest attendance center in our state, around 26,000 kids. And I was like, oh, good. Finally, I won't have to drive so much. 3 schools. I still could never be in the right school at the right time.
Yeah.
I have a theory that the minute the school nurse steps out of the building, there's a notification that goes to all the children that they need to go to the
call
office.
now. Yep. We need that school nurse.
That's right. So I was the building nurse for 3 years and supervisor for 3 years. And then we moved to North Dakota, and I had a different kind of a school nurse experience where I was a public health nurse, a school health liaison, and then eventually the director of nursing to 7 counties. And so there was just always a sense that there was never enough nurses and that kids' health was really at risk. So then about 10 years ago, I had the opportunity to come to eCare. And I always say I drink the Kool-Aid because I lived before. And so to be able to really help our colleagues and keep every kid safe at school, no matter where you live, is really what I love to do.
Yeah, absolutely. So when you think about your transition from being at the school to now, what are you seeing today that maybe is still the same of what you experienced being at this school, or just some of those challenges that we're still seeing now relevant?
I think one of the things we still see is, especially in our small schools, and it can be urban setting and it can be rural setting, that there's always a challenge to afford a nurse, a challenge for our educators to see that they need a nurse or to know what a school nurse does. And so that has not changed over the years. What has changed is our children come to school with more and more chronic conditions. And so you might be in a small school in Montana that has 100 kids that rarely do you need a nurse. But when you need a nurse, you need one now because it takes 30 minutes to an hour for the ambulance to get to you. So yes, things have changed, but there still is a gap.
Yeah. So what does that kind of look like when there is a situation like that and there is not a school nurse at the facility at that time? What does that process kind of look like right now for them?
Well, and right now for them, what it looks like is waiting.
Yeah.
And so there's a lot of anxiety because we have, well, one of the things I love about schools is so many times when you don't have a school nurse, who ends up taking up the slack is like a health educational assistant who has basic first aid or a secretary, someone who really is in the school because they want to help the kids.
Yeah.
Nobody is in education because you make a lot of money. And so when they are put in a situation where there needs to be more in-depth knowledge of health, there's so much anxiety because they are afraid that something bad is going to happen. And it would also hurt them as well as the children and the families. And so there's so much stress.
Yeah.
There's just a lot of stress.
Yeah. So when they do, not only the waiting, but how do they typically manage a situation from that standpoint when you don't have someone to call to? So yes, it's the waiting game, but is it strictly just them calling 911, or is there some situations where they do have someone that can at least take pieces of that? What does the whole kind of scope look like for that?
Typically, there's some sort of a first aid training, so it's a basic training that people have, a medication administration training. Although if you don't have a nurse, there's no one to call if the medication isn't right or if you're seeing something.
Yeah.
And so a lot of times they'll call the parents, which can be a challenge as well, where a nurse might be able to assess and keep a kid in school.
Yep.
A secretary or a paraprofessional sends the kid home. And so you think about learning days. In that educational setting, learning days are important. You can make up work, but you can never learn the same as if you're in school.
No.
And can I give you an example?
Yeah, absolutely.
All
Can you give
right.
me an example?
So a good example is a kid that we had that was in a small school, a really small school, actually about 30 kids, and they were coming every day after lunch. And so the secretary with a bellyache. So the secretary finally, after 5 days or so, she's like, I'm going to bring this kid on, but I know there's nothing the matter with him. He just does not like to go to math. Young kid, 6 maybe. And so the nurse came on, did the assessment, and there was nothing really remarkable that she could see. So she called the parent, and the parent was like, they do the same thing after supper. And so the nurse said, well, maybe you want to take him into the physician and see what's going on.
Yeah.
Took the kid in. It was really a reflux issue. Got the kid on the right medicine, and then it ended. But that took a different level of assessment than a secretary would have.
Yes.
And so what the secretary thought, which was nothing the matter with that, it was appropriate, that was school avoidance, but really it was a medical issue. And so that, I always say this example, like when I was in the buildings, I could dress up like a germ, and I could talk about hand washing and keep
it engaging
25
and fun. Yes.
kids engaged for 20 minutes. But after that, that's my skill set.
Yes.
Because I'm not an educator.
Yep.
It's the same way when you think about the medical side of it. Our secretaries and our health aides can do a small amount, but they can't do that in depth that really keeps kids in school and keeps them safe.
Yeah. Wow, that's amazing. It's a great story. And it just, we can get this in a little bit too, but you think from the parent perspective as well. And you talk about keeping the child in this school, but also thinking of how many times I have to leave to go pick up my child from daycare. And thinking about that from a school perspective, it's not only do you spend the 1 hour driving to get them, but then you spend the 2 hours getting to the doctor's appointment. So if there's something that you can solve, even at the school, supporting them, it's a big difference.
It is a big difference.
Yeah.
And the other thing we can do, and I know we'll talk about this later too, but is that assessment.
Yeah.
That we have equipment there that we can really do an assessment. We can look in that throat. We can look in the ears.
Yeah.
It's not just a FaceTime video visit. It's a true assessment, so we can give the parents the best information they have to know, do I need to leave work and go take them to the doctor? Is this something that I can wait on a little bit? And so we give guidance. Parents always make the final decisions. We're not physicians. We don't diagnose, but we give good, solid guidance.
Yeah. Well, and that kind of leads into, we always say from the school health perspective, we want to bridge the gap.
Yeah.
Can you kind of talk a little bit about, this school health program as a whole and what that means for us to truly bridge the gap within the school via virtual nursing?
Yeah, I think to do that, we have to talk about what does a school nurse do, right?
Oh, absolutely.
So a school nurse is a subspecialty of nursing. And so a school nurse speaks the language of education and the language of medicine. And they bring those two worlds together so that our children can have a good educational experience.
Yeah.
As well as being safe at school, so accidents, illness, injuries, and then our kids with chronic care needs like type 1 diabetes, asthma, seizures, so it's like that whole piece together. And so some schools don't have any nursing services related to geographical barriers, related to there's no one to hire, related to their size, they can't afford a full-time school nurse. And then we have other schools where they have an on-site nurse, but it was really kind of like my first experience of nursing where you have 5 schools and you can't be at the same place at the same time.
Exactly. Yep.
And so with those schools, we really come alongside of the schools and partner with the on-site nurse and say, what can we do to help? Sometimes it's doing the paperwork. Sometimes it's seeing the kids when the nurse is out of the building. And then that partnership. That's one of my favorite things that we do is that partnership. Because school nursing is also, when you become a school nurse, a lot of times you're used to being in a very supported medical setting. You're used to being in a hospital, in a clinic, and you come to the school and you're like a medical island in a school of educators. And many times those educators are friendly to you. They just don't understand what you do.
Yeah.
Once in a while we'll have some educators that are more like sharks, but that's not usual. That is not usual.
Yes.
But you are the only person in your building that does health. And so who supports you? Who comes alongside of you to help support you when you have to make decisions and you're not sure? But with us, there's a push of a button and you have a colleague there in the virtual room to support you. Can you take a look at this rash? What should I do with this? I had even a call today where one of the nurses said, hey, you want to look at all these bites? I'm not sure what they are. So I joined the visit and I looked at the bites too. And so we came up with a plan, called the parent, took care of what was happening.
Yeah. Oh, that's wonderful. So, okay, now that you've kind of given basically the landscape of what we can do, can you talk about the difference between supporting a school that does maybe have that school nurse that needs that additional support to review bites or rashes or whatever it may be, versus if it's just, and I shouldn't say just, but if it's a superintendent or the admin, someone who doesn't have any clinical background, but other than the first aid experience, how does that look like, or what does that differentiate between how we support them at Avell?
Yeah, so what we call that is primary care nursing. And really what that is health program support. And so it's still school nursing, just delivered in a virtual manner. And so we do immunization review, we write the care plans, we get the doctor's orders, we train staff, we make plans for our kids. If our student with epilepsy has a seizure, what are we going to do?
Yeah.
We make the plan, we train the staff so that there is a wraparound service that comes to help and keep those kids in school. The other thing that we do is we provide liability support for the school.
Yeah.
We had a student there was an accident at school. The insurance company came back. They didn't want to pay, but the documentation showed the school did exactly what they needed to do.
Yeah.
And so it was a support to help the administrators with liability issues as well.
Yeah, absolutely.
Yeah.
Well, and that kind of leads into, I don't know if it's a misconception, but when you're speaking to these superintendents or administrators, how do you explain to them the importance of having good school health available for the students there? Well, what would be your words of advice for that, or how you would really go about discussing the importance of that?
I think when we first started, a lot of our schools didn't know what a school nurse really did. And then I was trying to convince them what a school nurse did, how could it benefit them, and that I could do it virtually.
Yeah.
Or we as a program could do it virtually.
Yes, absolutely.
And so I think it's painting the picture. And really who helps to do that is other administrators. And so we had a school in North Dakota who was able to decrease their chronic absenteeism. We started with 2 of their elementary schools and grew to taking care of all their elementary schools because we decreased their chronic absenteeism by double digits, which is unheard of.
Yes.
And the funny thing is we didn't see all those kids that stayed in school, but they made a rule that before you could go home, you had to see the nurse. So some of the students were like, well, I guess I'll just go back to class.
They don't just get to go home anymore.
That's right.
Yes.
There was,
Yes.
like we talked about earlier, the
Yes.
secretary would just let them go home.
Yep.
But now that they have a nurse that needs to assess them, sometimes we talk them through it, and we figure out, is it, maybe it's an anxiety issue. Maybe they need to see the counselor. They present as a stomach ache, but maybe there's other things going on.
Yes.
So like in my earlier example, it was related to a medical issue, but sometimes it's not. Sometimes it's sleuthing it out, and sometimes it's really more a mental health issue.
Absolutely. Absolutely. So Sheila, you talked a little bit about the liability that some of the schools could see. Could you also focus on what are the risks that the schools could be carrying out without realizing it, without having the proper school health there for their schools and their students?
Yeah, I think part of that sometimes is that especially if you're in a small school district and you're trying to figure out how are you going to make that money stretch, and you're like, you don't have a kid with chronic issues like type 1 diabetes, and you're like, well, we could probably fudge on the healthcare. But what happens is there is a basic safety issue that a nurse brings to the students. And so let me give you an example. We had
absolutely.
a small school in Montana, actually, and a primary kid was stung by a bee. No big deal, went to the office, got first aid, went back to class. So they were a first or second grader. But teacher brought him back down in about 10 minutes because they were just getting so lethargic. So the secretary pushed the button. The nurse came up and got the history and said, I need to listen to the lungs. So they listened to the lungs of the student, and there was not air moving. And they were having a life-threatening allergic reaction to this bee sting that they've never been stung before. Now, we had put a program into this school that was called the Epi for Schools program. That is for just this reason. If there is a life-threatening allergy that comes up that no one's aware of, there's epinephrine, which is a treatment for that. And so the nurse said, we're just going to need to get the epinephrine. I need you to call 911. And the secretary, rightfully so, was like, can we just wait till the parents get here? It'll be 20 minutes. Well, we couldn't. It was a life.
We don't have 20 minutes.
We don't have 20 minutes.
Yeah.
The nurse says, you've been trained. I'll talk you through it. We'll be good. So they gave the epinephrine. Ambulance got out of its way. It took about 20 minutes to get there. Parent met the kid at the hospital. Truly, a life was saved. But you wouldn't, as an administrator, think about that. You know, you wouldn't think about that because there was very few meds that needed to be given. There wasn't really any chronic health care issues. And yet, that can change in an instant.
Absolutely.
And, you know, with some businesses, you know, you can have 95% success rate, 98% success rate, and you're good. But in a school setting, it needs to be 100%. Because one child loss is too much.
Absolutely.
I mean, that's the whole world of a family.
Yes.
Let alone the school. I mean, you can go on and on with the losses. And so sometimes I think when these administrators are having to make those hard decisions, it seems like the nurse maybe is the one to cut.
Yeah.
But it is a hard and a risky cut.
Oh, 100%. Well, I just remember when I was getting diagnosed with like all of my GI issues, I'd go to the nurse every single day and they were like, what is your deal? Or do you not like being here? And I'm like, no, something's wrong. But I just think if I wouldn't have had the opportunity to talk to someone else other than my parents thinking it was, an anxiety of going to a class. And I'm like, no, every time I eat, I don't feel good. Well, come to find out it's all these allergies. So, you know, it's just having that support system to talk through that. And I can't imagine my kids now going to school and not having that support. You already have a tough time sending them to someone else. And it just helps kind of have another level of support and comfort for a parent sending them to school. So you've done a great job of outlining, you know, several different situations or conditions that you have seen virtually. Can you go a little bit deeper into all the different chronic, acute, all the different types of conditions that you work with on a day-to-day basis, or maybe not a day-to-day basis? Just give us a little insight into that.
Yeah. You think about your students with diabetes, so type 1 diabetes, which is on the increase in the United States here. And it's interesting, we have increasing technology to take care of our students, which is so great.
Yeah.
So we have continuous glucose monitors, we have insulin pumps, but you still need a critical thinker to help guide the school staff through this really process of diabetes and taking care of these children.
Yeah.
And so some of our students start so young. We have a couple of kids that will now be becoming fourth graders, but we started taking care of them when they were 3. So these are our 3-year-olds with type 1 diabetes.
Wow.
In a school that didn't have a nurse. And so now they've had the same nurse for 7 years. There's been a partnership that's developed with the school staff, with the kids, of course. Jennifer is their nurse, and with the parents. And the parents were actually thinking they might want to change schools, but kept their children there because they said, no, Nurse Jennifer is what we need. And so that's an issue. And so diabetes, when you go low, it's a life-threatening condition, really. And so one of the things that we've found is what helps that is having a plan. And so we went into some schools that had not had any nurses in the school setting, and they had used glucagon, which is a life-saving medicine that you give when a child goes too low. They had given it 4 times in the previous year. I have not given it in my whole career.
Yeah.
And so we went into the school, set up a plan, trained the staff. What do you do in case of a lows? Coming on us with us for the insulin oversight. No glucagon given the whole year.
Wow.
And this was a large school. It was about 1,000 kids.
Yeah.
And so I think when you think of those chronic care kids, it is true that the treatment is important.
Absolutely.
You know, like, so coming on, oversight, carb counting with our kids with diabetes. But the other thing that's important is the planning and the training that goes with that. You think about your students with seizures. You think about asthma. You know, all these different chronic conditions. And as we're able to save more, it really starts at birth, right? As we have more and more NIC babies that we're able to save, sometimes there's chronic conditions that come with that. But other times it's just something that happens. But those kids deserve to have the same kind of school setting and school education that every other kid does. And so what the school nurse does is help keep those kids safe at school by making a plan.
Yeah.
And teaching the staff, and then make it so they can come on with us. In fact, we just finished a research study that was funded by Helmsley Charitable Trust and Breakaway T1D. And what we have found is that with the intersection of a school nurse, in this case it was virtually, and we were able to decrease the hemoglobin A1C, which is a monitoring of the blood sugar, the blood glucose, over months by 0.5 point. Which is huge.
Yeah.
And so, and the only intervention was the school nurse.
Wow. That's incredible.
Yeah.
And this, I mean, we talk about type 1 all the time because, like you said, it's on the rise. But how do you promote this team at the school to call a vel? Like, how do you make sure, like, it doesn't have to be this type of situation or a 911 situation. It can be really anything. So how do you kind of help guide them to make sure that even if you just want to talk through something and get the extra level of like, you're doing everything you're doing right or everything you can in this situation?
Yeah. So really what we teach is we teach the school staff, you know, you can do first aid, but whenever you're wondering, I wonder if that's an assessment.
Yeah.
An assessment piece belongs with the nurse. And so we assign one nurse to every building, because one of the things that we've learned over time is you can have a really good school nurse. You have to have someone that is very collaborative and good at developing relationships, because the school staff is going to call someone they trust.
Yes.
And so that's really that important piece of what we do is we develop relationships. We keep it so it's not like that same nurse can do every single visit for the school, but they have one contact person that they always, that's their person.
Yes.
You know, that they develop their relationships with. And we have a small school that happens to be on a reservation in South Dakota. And our secretary there is probably in her 70s. And the technology, she can do it.
Yeah.
And she says, I'm willing to do it because I want to talk to Nurse Pat. Because awesome. Nurse Pat tells me what I need to do.
Yeah.
And I know this community, I know these families, but Nurse Pat knows the medicine.
That is adorable.
Isn't that great?
That's amazing. Well, and just to think that, you know, technology is not always easy. And so for her to say, like, I want to learn this and be able to do this to help care for the kids here, that's amazing. Will you give us, I know it's not visual, but can you kind of talk through how the equipment works and how they on their side, you know, push the button, quote unquote? What does that really mean? And how does that activate an assessment or an encounter on our end of the side?
Yeah, so we really do on-demand nursing care. And so what that means is the site gets an iPad, and then we have kind of a box that is about this big. It has a thing that looks like a doorknob.
Yep.
And with this doorknob, it's called the peripheral device, but with this doorknob, we can take a temperature, and it's all led by the nurse. All the people on site have to do is put their hands up. We push the button. We can take a temperature. We can put on a stethoscope piece, which is blue dot to blue dot.
Yep.
Simple.
Yep.
We can listen to the heart and lungs. We show them where they put the stethoscope. We have a derm cam. We can look at a laceration. We can check the pupils when you have a head bump injury. I know it's not the favorite thing we love to look at, but you can also look for lice eggs.
No, that is not something we like to look for, but yes, you have to do that.
Yeah, to give guidance to the parents.
Yes.
What are we seeing? Look in the throats, look in the ears. And we train the staff on this, but we started using this equipment about 8 years ago. And the reason we changed to this equipment is because it's called TytoCare. The reason we changed to it is because of ease of use for the layperson.
Yeah. So that anybody can use it.
Yeah, and so it's HIPAA compliant. We never put any student information into this tablet, into this system, but it also is not FaceTime. It's an actual assessment that happens. And the amazing thing is, when you listen, it is like I'm here with you and I put the stethoscope on your chest.
Yeah.
And sometimes when you're done with an intense visit and you turn the camera off, you're like, I wasn't there.
Yeah.
Because it is so encompassing and so good.
That's amazing.
It is amazing.
Because I think we've talked to several others, they're like, I always want to jump through the screen. That is part of the thing of like, it took me a second to get comfortable with being like, I can't just jump through in an emergency situation. So to be able to feel like you're still there in this situation is fantastic.
Yeah. One of the things that's been interesting to me about virtual care that has been surprising, I would say, is that when you come on camera, if it's an emergency situation that they're dealing with, or let's say a student that was having a lot of anxiety, was hyperventilating, when I came on camera, I said, okay, you're going to look at me, look in my eyes, and we're going to breathe together.
Yeah.
But it was like I could feel the whole room relax. Just like when I would walk in the building, if there was emergent, and I would walk in the building, and it was a hyperventilating. It wasn't that this was an emergency situation.
Yeah.
But there is a sigh of relief when you're an educator and you have someone medical either come into your office virtually, just like if you come in physically.
Absolutely. So when someone pushes the button, how fast does that really connect with us on our side? Because, some people are like, gosh, is it going to take 30 minutes like it would waiting for the ambulance? Or how fast is that reaction on our end?
Our average response time is a minute.
That's amazing.
Which is why it really is on demand. And that all-day access is important. So you might not use it for a week, but then when you push the button, the nurse is there.
Yeah.
And I think that's what is the important piece.
Yes.
Because even if you're on site and you have multiple buildings, you're not at your school all the time.
No. Wow. Well, and just to build, I'm going back to when you're talking about all these relationships and building those relationships. I think one of the first times I came into the school health hub, talking to one of your nurses, and they're like, I've seen, like you said, this patient since they were little, and now they're graduating, and I got invited to their graduation party.
Yeah.
You just don't hear that. To just hear, you're not seeing random people all the time. You are having the designated 1, 2, 3, however many on our team, but you really build that connection, especially with type 1 diabetic patients and how that helped them through their school journey. And maybe that might have looked different if we weren't there to support them.
Yeah. Well, it means that the kids aren't the ones that are having to make all the decisions about their health care.
Yeah.
Which is a lot for a younger child or for an elementary child, or sometimes when you're in middle school, you just don't want to be different than anybody else when you have T1D.
Yes.
And so it gives kids a break.
Yeah.
So that their brain isn't consumed with helping to take care of the healthcare. They really can learn and be relaxed about those healthcare decisions. That's what the better technology is helping with too.
Absolutely.
But there still are so many decisions that have to be made by people around them when these kids that have diabetes. Yeah. And it's not really just diabetes either. You think about kids that have feeding tubes, that we oversight the feeding tubes. So the kids that have to get feedings at school. We just have a lot of kids that have just little differences.
Yeah, absolutely.
That we help to normalize so that they can have a good school experience.
100%. Well, okay, give me an example, or maybe you have a story too of a school that didn't have a VEL and then implemented it. And then what did they start realizing, or what was a surprise to them after, really integrating a VEL e-care to their team?
Yeah. Well, I told you about the chronic care or the chronic illness, chronic absenteeism, which is a big deal in a school setting that went down. That was one example. But I had an example of a school in South Dakota that had never had a nurse. I think they had about 250 kids. And so we convinced them that they should have us. So as we started, the superintendent told me, she's like, I had no idea a nurse did all these things. I had no idea that we didn't have to take care of our own immunizations, that you would call, you would talk to the parents, you had all the right knowledge. I had no idea. And she said, I have a nurse that lives down the street. And I was like, does she want to work for the school? She was like, she might. I said, well, go find out.
Yeah.
So she hired her. But again, the nurse had never been in a school setting. And so then we were an extender for the next year and trained that nurse. And then the following year, they didn't have a gap. And so we no longer serve the school, which is a success.
Yeah.
It's not like we say that we're the only solution.
Yes.
But we really can fill that gap and can support others so that when the school's like, wow, that's what a nurse does?
Yeah.
Or we have another school in North Dakota that the secretary said, they've had us, I think, 9 years.
Okay.
And they were like, the secretary said, if you cut a VEL, I am quitting because I'm not going to do this without them.
Yeah.
But they're long-term relationships.
Yes. Well, and you think of in the hospital setting, if they did any clinic work, hospital work, they always have a team. So you might be the only nurse on call, but you can still go talk to someone down the hall. Like you said, you're kind of in your own little bubble here. So just having you to call and ask for support is just tremendous.
Yeah.
And I know we've touched on this a little bit, but can you talk a little bit about the inside of the building and how this impacts the school staff day to day with having the support of a VEL?
Yeah. So there was a study out. I'm not sure when the study was done, to tell you the truth, but it showed that having a nurse in your building saved 20 minutes a day for teachers and 40 minutes a day for administrative staff. And so you multiply that times the number of teachers that you have. It allows people, our educators, to do what they're trained to do, to be educators instead of trying to do healthcare. And so I think that's one of the ways that we really make a difference.
Yeah.
But it's even keeping the kids in school. So yes, the kids learn better when they're in school, but when they are absent, that educator has to do all the makeup work, pull everything together so that the student, when they come back, can make up the work.
Yeah.
That takes a lot of time.
Yeah. A lot of time. I just think of when we'd go on vacation for a day or two and the amount of time that we would prep to go on that and everything else that goes with it. Yeah, it's crazy. So that's great examples of how the impact of this happens inside the building. But let's even go further and look at outside the building, within the community and the parent relation and how this impacts them. With having a school nurse in the building, what does that impact benefit them versus not?
Yeah, and so it makes it so that they can stay at work. They can feel secure that their children are safe.
Yeah.
And again, when we do those assessments, we do a follow-up call. We don't just see the kid and then not let the parents know what's going on. We let them know what's going on so that we can say, we looked at your child's, example would be an ear. We looked at your child's ear. They don't have a fever. Their ear doesn't really look red. We gave them a warm pack for comfort. It might be related more to fluid or allergies. We're uncertain, but we think that they can stay in school. You don't need to miss work.
Yeah.
Now, you can if you feel like, that's an appropriate thing to do. But when you think about many of these, the rural settings especially, but it's even true of the urban settings, it might take a half an hour to get back to the school from where you work, and then it's going to take another half hour, an hour to get to the doctor.
Yes.
And then it's going to take more time. So you've missed at least a half day of work.
Yes.
Now, there's times that is appropriate, but there's times that can wait. But that can only wait if you know what we're seeing.
Absolutely.
If you know what's happening with your student.
Yep, absolutely.
And I think, too, when you think about, like, if there's an unlicensed person that's making those assessments, they can't make the assessment, so the parent just needs to come.
Yeah.
And so we allow the parent to have better information so they can make their best judgment.
Absolutely.
And we actually have had situations where parents had their kids at a school that had a health aide that they called a nurse. And then we came in to help support the health aide, and they were like, "That's not a nurse?" And we're like, no, it's not a nurse.
Oh my gosh. Yeah. See, and I don't think that's ever understood, because coming where I came from too, I mean, we were a very rural school, very small, but we had a school nurse that was there 24/7.
You were from Minnesota, right?
I was from South Dakota.
Oh, you were?
Yep.
Where were you?
Tri-Valley.
Oh, okay.
But it's like that I always had, and it was two of my students, I think it was their aunt. That was our school nurse, but I mean, we had one every single day. But then I have other friends who are like what you were saying. I bop around to 3 different schools within this little area, but it takes me 45 minutes to get to each one. So I stay one day here, one day there. I just don't think people understand that.
I think sometimes too, they also don't understand what a nurse might catch. Just like in your like in your instance, or like the kid with the stomach ache,
Absolutely.
There's a level of assessment that happens that really says, hey, something's not right. And so a parent might not think about that, or to go to the doctor, or might not even be aware.
Yeah.
We had a kid that we did a vision screening on. 1 year his vision was 20/20. The next year it was like 20/200. And I was like,
what?
I thought he was faking it.
Yeah.
I brought him back in. I tested him again. I called the parent. I'm like, I think you need to take him in. I just don't know. He had a tumor on his eye.
Oh my goodness.
And so I think that people we don't think about that.
No.
This is a well-child environment, is typically what a school is. And yet, so many times the nurse is that first access to health care that student will have. And they catch it. They catch the going to the bathroom a lot to say, call the parents and say, hey, we have noticed this, that they go to the bathroom a lot. I don't know whether you've been noticing it too, that they've lost weight. Yeah. This can be a sign of diabetes. It might be worth to take them in.
Yep.
All those little pieces.
Well, I just even remember, I don't remember the story exactly, but you were telling me about they felt like they were having anxiety and it ended up being, was it a heart condition or what? Yeah.
Yeah, we had a kid at really remote school.
Yeah.
We listened to the heart, and the heart was beating 170 to 200 beats a minute.
Oh my gosh.
Nobody could have even felt that. There's no one on site that could have felt that. They're 60 miles from a hospital. It would feel like anxiety, but they had Wolff-Parkinson-White syndrome, and that was what it was diagnosed from that start. Yeah, it's amazing.
It's absolutely amazing. Well, and just to hear all of the different stories and the unique situations your team has experienced, it's wild.
We had a student that was saying, like, I feel like there's something in my ear, like it feels kind of tickly.
Yeah.
And so the nurse looks in the ear and she goes like, ah! And the kid goes, ah! Because there was a bug in his ear.
Oh my gosh.
And on our screen,
the bug's
looks huge.
Yuck.
So,
no, thank you.
Thankfully, it crawled out on its own. But otherwise, it would have been a doctor visit because nobody could poke in tweezers. No, we don't do that. Or our other funny thing that we always are like, when a kid comes into the office and says something like, I think I might have an eraser in my ear. And you're like, you think?
Or
Who put that eraser in your ear?
Exactly.
Well, you put the eraser in your ear.
Oh my gosh.
And then you look, sure enough, there's a eraser in the ear. I had another kid that said, I think I have rocks in my ear. And I was like, I was earlier in my virtual nurse career, and I was like, you don't have rocks in your ears. I should have known.
He had rocks in his ears.
Sure enough, he has rocks in his ears.
Oh my gosh.
I was like, how did you get rocks in your ears? And he's like, my brother put them there. You're right. He did.
Well,
Okay.
I remember one of the episodes of House, the little kid kept putting these miniature figurines up their nose, but it was for attention. They weren't getting attention, and that was the way to get attention. So they kept coming in, and every time they kept a little collection off to the side of the 9 figurines that he had stuffed up his nose.
And it's a developmental stage.
Yep.
Where young children are like, oh, what's this
Gotta
orifice?
test this out.
What's this orifice? And they just put things there for God knows why. We don't usually ask, why did you do that? We're just saying, like, tell me about that.
Yes. And maybe let's not do that again. Yeah. I know you've shared several different examples, but is there one throughout your career that really stands out to you that you've experienced?
With the parents?
With parents, with a child, or both?
One of the things I think of impact to families, we had a school, I think they had 6 kids with type 1 diabetes when we went in. They're about 350 kids. And one mom was coming to school 2-3 times a day to give insulin because there was no one to give insulin at the school. She had twins that were under the age of 1. And so every time she'd have to pack these kids up, come to the school, give the insulin, go back home. Wow. When we went into that school and started serving, doing the oversight of insulin, teaching the staff, and just seeing the kids, really, she cried because it allowed her to stay home with her young children. It took some of that stress off. As the kids grew, she went back to work. But otherwise, she said, there's no way I could have worked outside of the home.
No.
And so you think about the impact of that.
Yeah.
That is a big impact to family.
Yeah, absolutely. I just know that just from my own experiences. It's just, yeah, the thought process of it too, and just that mindset of taking the minutes out of the day when you're constantly thinking about it versus the driving time versus this. There's a lot that goes into it. So like I went back to the comfort of knowing that you're there, supporting their child means everything.
Yeah.
Yeah. So let's also talk about behavioral health a little bit, as I know we did a little bit with the anxiety piece of it or any other mental health issues, but what does that role play within the Eval School Health program?
Yeah, so we have MSW, who is a clinical person who can do therapy in the school setting. And so some of our schools don't have access to therapists. And so in a school setting, there's a tiered approach, school counselor might do guidance for everybody. It's like a pyramid.
Yeah.
And then you have like what they call tier 2, where they can do a little bit of intermittent counseling. But then you have the tier 3, kids that have had trauma, kids that maybe have had grief, things like that, that really you need someone that is a therapist that can help these kids out.
Yeah.
Also, sometimes if you think about in a rural setting, a real small school, we had one kid who was like, my mom knows the counselor. I don't want to talk to the counselor. They wanted some anonymity.
Yeah.
And so what the therapists do is they go in and they help kids through what they need to help them through. And one of the things that I have loved about that program is it really changes trajectory.
Yeah.
And so I think about how the school nurse saves lives and changes educational outcomes. But the therapists really change the trajectory of a kid. So if you have a kid that's barely bumping along because of grief, because of trauma, because of whatever, they could kind of go their whole life about like this. But with some interventions from the therapist, they can really soar.
Yeah.
And that has been an amazing thing to watch and how that impacts them. And it doesn't, a lot of times, it's not like an all-year session.
Yeah.
It can be 6 to 12 sessions, and it can just help kids get over the hump to really be able to process what they need to process
Yeah.
and to move along in their school experience.
Wow. Well, now is a fun time because we're in the summer. And so, we may have some school stuff going on, but it's not in full gambit like it was before. But as we start thinking about the next school year, which is crazy to already say, but starting to think about that, what should districts or superintendents be thinking about from a school health perspective?
I think this is the time of year when districts start thinking about who is it that's going to fill that role. If we don't have that role filled, how could we fill it in a cost-effective manner?
Yeah.
And so this is an option to be thinking about of how do you get all-day access to the nurse? How do you get access to immunization review? Someone has to do that work. Those are things that are required of schools. Is there a way that you can get someone to do that work for you, and so that your school staff could be freed up to do the rest of their tasks that they have to do?
Yeah.
So one of the things we do is the on-site staff has to help with the visit, but we do all the follow-up calls. We do all the charting. We pull it together. So we save the school staff that see the kids so much time on the back end.
Yeah.
So I think if they can be thinking about right now, what is it that we need to do to fill that role?
Absolutely. And where to invest that time and attention at. Yeah, absolutely. Well, and what conversations or what questions should we be asking them, or they be asking us to help kind of guide them to understand where those gaps are?
I think first off, we talk about safety, which I know safety and liability is always on a administrator's mind because they feel that burden of that in their school setting. But sometimes they feel like their hands are tied. So helping them to understand there is a cost-effective way that they can help provide more safety to their school staff. And it's not, you don't have to choose this versus that. It can be all-encompassing is a way we can help.
And then when you think about this too, I know like ROI and thinking of the budgetary perspective of this, that's always a conversation of anything right now. How do you explain, there are some situations where we can be that person and that's what this dollar amount would mean. And sometimes it's just we're that extender and not maybe the primary. How do you showcase the ROI from a school health perspective?
I think really when you think about school health is keeping kids in school. So we have a 90% return to class rate. And so there's a couple ways that you think about the ROI. You think about it that way because that saves the school. Their job is to educate kids. So if they're in school, they can educate them the best way they can.
Yeah.
We also think about with that return on investment, how do you use the school staff you have right now to the best capacity that you have? Who can you bring in for a cost-effective manner to help with your safety of your school kids?
So what keeps you optimistic about the future of school health?
The kids. The kids are just the best. They have a freshness to them.
Yeah.
They have a way of just encouraging the adults around them, I think. In a lot of ways, schools are a very happy place. Now, that's not the case of everything, of every child. We do make child protection referrals.
Yeah.
And even though those are such heartbreaking situations, those also save lives. And I think about that impact too. And so I really think about the impact of school health as a life-saving program and a program that helps to really help kids to soar. And that should be encouragement to us as a society, because when our kids are thriving, our whole society thrives. And I think putting our thoughts toward that is really important. That encourages me a lot.
That's beautiful. Sheila, thanks so much for joining us today and really talking about the importance of not only helping our schools, but the children within the schools and the staff. It's just a very unique conversation, and I'm so glad we got to have this today.
Well, thank you for showcasing the school setting.
Absolutely.
Children are our future.
Yes, they are. Yes, they are. And thank you for joining us on Avell eCare Virtual Health Connections. If you found this conversation helpful, we'd love for you to subscribe, Share it with your colleagues and stay connected with us as we continue exploring telemedicine and the future of healthcare delivery. To learn more about Avell eCare and how we're supporting care teams across the country, visit avellecare.com. Thanks again for listening. Until next time, stay connected.